weekly COVID update, and then we'll have a few other pieces of news. Top line is cases continue to fall. We're still having significant death, but cases continue to fall. So Saturday's number, 3,755 new cases, 48 new deaths, and some younger people, 37-year-old woman from Bell County, 48-year-old man from Laurel, and a 39-year-old woman from Metcalf. Sunday, 2,270 new cases, 36 new deaths, including a 38-year-old from Fayette County. And today, 1,907 new cases, 32 new deaths. It includes an 18-year-old boy from Bullock County. Positivity rate now down to 17.93%. Good to see that falling. Now, for the chart that was the scariest and now is starting to look so much better, our stair stepper chart. As you can see, this is our third straight week of declining cases. Now 35,961 cases from last week, but that is still the sixth highest caseload that we have had in the pandemic. But certainly the trajectory is exactly what we want to see, steadily, if not quickly, dropping. I believe that it would look even more significant, but for the week before, which, as you remember, with ice storm and others coming, we had a number of days where testing was shut down. So this probably would look like a steadier fall had we not had that weather event. Positivity rate also decreasing. Remember, this one is less impacted by the actual number of tests. So you see a steady fall week after week, tests and positivity. So looking forward, being on this good trajectory in regards to cases and positivity rate, if these trends continue, we believe Kentucky will move out of the red and into the orange or even the yellow conservatively by March the 14th. That's when we will be in a much better place, as long as we continue to see these declines and the rates of decline. With that in mind, our goal will be to provide new guidance as of that date, simplify some of our guidance that's out there. Certainly, if we are in that better place, the guidance will provide significant more flexibility and recognition of where we are in the pandemic, with not only cases and positivity declining, but also Omicron being something very different in terms of the level of disease it causes versus previous variants. Our goal would also to be able to look at our practices in state government and see what is or isn't necessary at or around that time. Again, we are on a good trajectory. This is our best projection at when we think we will be in a good place based on the current rate of falling cases. It's not just cases that are falling. We have hospitalizations. If we can pull up that one, a good downward decline, trailing a little bit the case decline, which is natural. ICU also going down, as are Kentuckians on ventilators. When we look at hospital capacity, if we have that one, remember every region was previously red. On this one, actually, you can't see the 8 is a slightly different color than the reds. That looks orange, with the others being blue. So a little loosening, a little bit better on the hospital side. Over the weekend, 4,307 Kentuckians getting their very first shot of hope, 5,461 becoming fully vaccinated, 7,351 getting boosted. This is up a little versus a couple weekends before. We have seen vaccinations declining. This was, typically in a higher area, certainly during Omicron, but it at least looks like it's going to stay steady with people getting vaccinated. We are not dropping towards zero. And what happened in the past is we leveled off at the lowest point, about 1,000 new vaccinations a day. Hopefully we will be above that as we move forward. Looking at our demographics, still 64% of all Kentuckians having at least one shot, 68% of all those who are eligible, 5 and up, 76% of Kentuckians who can make their own healthcare decisions have chosen to get vaccinated. The changes this week are 18 to 24-year-olds are up a point to 56%, and 12 to 15-year-olds up a point to 48%. But certainly those that we are seeing with the highest incident rates of COVID are the ones that are in red, that are the least vaccinated. And that's where we can do the most work, the quickest, to up our vaccination rates, which I believe gets us out of the pandemic that much faster. We've been able to reduce our National Guard force a little bit, now 318 guardsmen that are split between hospitals, some of our state institutions, and a couple at food pantries helping out. With that, I'm going to turn it over to Dr. Stack to comment on a few things out there, some new studies, especially on the impact that COVID can have on pregnancy. And then we'll come back with a couple other pieces of good news.
Thank you, Governor Beshear. Good afternoon, Kentucky. So I would just emphasize briefly the governor's good news. The cases continue to fall and the test positivity falling very rapidly, which is what we had hoped we would see. In all the New England states that I'd previously used as comparators, they continue to decline. So hopefully if they are a predictor for what we have ahead, we'll continue to see these falls. And I share the governor's confidence that by the time we get to mid-March, we should be in a much better place. And I look forward to giving some additional or different guidance that hopefully simplifies the paradigm just a little bit, but still reminds us all we're in the middle of a global pandemic. It has surprised us and thrown curveballs multiple times over the last 2 years. And it's really, really imperative that we continue to take reasonable and responsible steps to try to minimize the risk that it gets worse, so that once we have these gains, we can keep the gains and go on with our lives much more like we used to know them. I want to talk today just briefly about COVID-19 and pregnancy. There have been some studies that have been published in February, and I think this has resulted in some additional news coverage. The points I'd like to emphasize, first of all, is that obviously we want to make sure that we have healthy mothers and babies. And if there is not a healthy mother, there can't be a healthy baby. COVID-19 remains a bad disease for many people. And unfortunately, for pregnant women, not unlike influenza is a worse disease in pregnant women than in non-pregnant women, COVID-19 increases the risk for bad outcomes, hospitalizations, mechanical ventilation, even death for women who are pregnant versus same-aged women who are not pregnant. And so obviously when we want to celebrate the arrival of a new life, to celebrate the loss of a mother and or their unborn child is a particular calamity and tragedy. So I want to emphasize that vaccination helps to mitigate or almost entirely prevent most of those bad outcomes. So we can take something that is thankfully an uncommon bad outcome and make it almost a non-existent outcome, which is what we want to do. So the American College of Obstetricians and Gynecologists are very explicit in a statement that they've had out for a while, but was revised in January. They strongly recommend that all pregnant persons be vaccinated against COVID-19. Vaccination can be provided in any of the trimesters, and mRNA vaccines, which really are the only ones largely available now, are preferred. They also note that none of the COVID-19 vaccines available in the United States cause infertility or spontaneous abortion or miscarriage, as the more common term is. And there is no evidence of adverse maternal or fetal effects from vaccinating pregnant persons with COVID-19 vaccine. And there is, in fact, a growing body of evidence that supports not only there's the absence of harm, but that they are demonstrably safe. I'm going to give you 4 studies I'll just mention briefly. There was one in February 10th, that was published about 64 stillbirths and 4 early neonatal deaths from multiple countries around the world. Every single one of the mothers was unvaccinated with these outcomes that occurred, and they found that damage was done to the placenta. And in fact, on average, about 3/4 of the placenta was damaged so badly that it couldn't convey adequate blood flow to support the unborn child. And that was the way it caused the harm. There's another one that was published last November 26th, in the MMWR that the CDC publishes. It was about 15 deaths of mothers in Mississippi. One person had received 1 dose of a vaccine, I believe. The others were unvaccinated, some of them before vaccines were available. The median age of the people who died, of the mothers, was 30 years. So obviously these are individuals who shouldn't die and almost certainly would not have died were it not for the fact that pregnancy raised their risk from COVID-19 harm. So folks, those deaths largely in today's world could be prevented simply by getting vaccinated. Now, there's 2 studies that came out very recently, one on January 7th that was published in the CDC's Morbidity Mortality Weekly Report, that talked about the safety of vaccination in pregnant women. They reviewed over 40,000 pregnant women, and they found that COVID-19 vaccination during pregnancy was in no way associated with any increased risk of preterm birth or small gestational for age babies. They found no signals of harm or damage caused by the vaccines. There was another study in the Journal of the American Medical Association Pediatrics Journal, and they found that the Pfizer vaccine, that there was absolutely no difference in any sort of small birth weight or preterm birth problems, whether you were vaccinated or not, meaning that vaccine made no increased risk whatsoever for any of those adverse harms. So folks, the bottom line is we all need to get vaccinated. Vaccination helps to keep us all safe from the illness and the worst harms that can be caused from it, particularly in the pregnant mother and the unborn child. The mother faces higher risk because of the other physiologic changes that happen in the mother's body, and the vaccinations can help to avert virtually all of those harms and keep the mother and the unborn child safe, and hopefully lead to a wonderful birth and a wonderful young childhood ahead. There is absolutely no evidence that the vaccines cause any harm to fertility or any other complications related to pregnancy. And in fact, the longer this goes on, with now more than 10 billion doses of vaccine delivered worldwide, we are developing a mountain of evidence, multiple mountains of evidence, that the vaccines are safe and that they protect people from the worst harms while causing no meaningful harms of their own. So folks, I continue to encourage folks to get vaccinated, be kind to each other, still wear your masks, hang in there just a few more weeks. We want to get this virus down to a low enough level that when we lighten up some of the use of the masks, we are not at risk for bouncing back up and seeing an escalation again. So thank you very much, Governor.
So in non-COVID news, today we announced another major step towards the construction and development of the Ford Motor Company and SK Innovation Blue Oval Battery Park to be located in Hardin County. In September 2021, I was joined by Ford's CEO, Jim Farley, and Executive Chair Bill Ford, along with Dong-Si Ji, President of SK Innovation's battery business, to announce Blue Oval SK. The $5.8 billion project is the single largest economic development investment in our history. It's going to create over 5,000 direct new jobs. This transformative development requires the construction of an on-site training facility, which will also be a new satellite campus for the Elizabethtown Community and Technical College. And today, the Finance Administration Cabinet, on behalf of KCTCS and Elizabethtown Community and Technical College, released an RFP seeking professional design and construction administration services for the new on-site facility to be constructed in Glendale, Kentucky. This is a cutting-edge, flexible facility designed to meet both initial startup and long-term educational and training needs at Blue Oval SK. Once constructed, it'll provide the classrooms used to train the employees who will produce electric vehicle batteries at these facilities. It'll also include the laboratories that'll be used in research and development of this advanced technology, as well as providing offices and meeting space for faculty and staff. The RFP is available on the Finance Cabinet's procurement website. This is a major step, and we've had other major steps, different permitting steps that we've been able to get through with a project that is on track and so exciting. When we made the announcement today, Director of Workforce Development for Blue Oval SK Battery Park, Liliana Ramirez, said the Commonwealth of Kentucky and the Elizabethtown Community and Technical College's new state-of-the-art facility on site at Blue Oval SK Battery Park will allow Kentuckians to develop the skills needed as we prepare to usher in a new era of manufacturing there. All right, finally, a few updates on tornado relief. First, as of today, we believe we are now 41% through debris removal. We keep pushing and pushing. Certainly, Graves County still with the most debris isn't near the 41%. Many other areas getting even close to completion. In our parks, as of this morning, 243 displaced guests, displaced Kentuckians are being housed at Kentucky State Parks. The individuals and their families are spread primarily across 4 parks. That's Lake Barkley, Kentucky Dam Village, Pennyroyal Forest, and Kinlake. They're currently in 57 lodge rooms and 32 cottages. With the declining number of Kentuckians who need sheltering, we're going to soon start consolidating these guests into a smaller number of parks by transitioning individuals both to other parks and to midterm housing options such as the travel trailers and cottages, both of which are more private and offer kitchens. As a reminder, storm survivors who need help with housing through our sheltering program must apply through FEMA. Last week, the deadline for FEMA assistance was extended to Sunday, March 13th. So again, to be eligible for medium-term housing, displaced families must register with FEMA. You can visit disasterassistance.gov. You can call the FEMA helpline, 800-621-3362, or you can go to the FEMA app. As of today, we have 28 Kentucky families in travel trailers. We have 32 families that are pending to be placed in them. That breaks down 13 in Graves, 10 in Hopkins, 6 in Warren, 3 in Muhlenberg. Calls to survivors continue, but our biggest challenge is people not picking up the phone. We can place a lot more families, but typically less than half, sometimes significantly less than half of the people that are called pick up the phone, even though we're calling the number that the individual left with FEMA. We're also having people that aren't opening emails sent to them, saying we want to help. We want to check to see if you're qualified for one of these travel trailers. So please pick up the phone. We've got many more of these to place people in, and it gives you a little more breathing room. And we want to make sure that we are continuing those steps towards recovery. All right, with that, we will open it up for questions. We've got Karen Czar here in studio.
One for you and one for Dr. Speck. You mentioned last week, and Dr. Speck has mentioned that soon, we could be a few weeks away from recommending loosening on mask requirements or recommendations. What do parents need to know? Because obviously districts and schools, some are already making that decision. What should parents be looking at when they make decisions on sending their kids to school? And then are either of you concerned, or do you think it's a good thing to Pfizer pull back on the under 5? Do you think it's going to make people more concerned or more at ease, knowing that they're taking more time?
Okay. So we just had a great week of declining cases, but it's still our 6th highest week ever. Our positivity rate continues to fall, but it's still one of the highest that it's been in the pandemic. So while we are seeing fewer cases, it is still everywhere. Most of the state is still red. So parents, certainly you want to have your kids in masks when they're in a place where people aren't very vaccinated and there's a ton of them and they're close together, that's school. For better or for worse, that is school. Whether the school is mask optional or required, I think every parent should strongly consider the mask, because we want those kids, and I want my kids in school every day. I had a son that had to miss a week of school, and I want him in school. I don't want my daughter to miss a week of school. I think that we could be moving towards a place where it could be a more challenging decision for parents if we are in a much better place. But I still think that parents need to consider the level of vaccinations amongst a group that's some of the least vaccinated. And then we'll see, what our incident rate is, what our positivity rate is, how many cases there are. But if we continue to plunge like we are now, I think that there are some school systems that, again, probably mid-March could take a very realistic look at where we are and probably make a rational decision about maybe not requiring them.
So the best thing perhaps should be to continue to watch those red zone, blue zone counties.
Absolutely. And just at the moment, remember that it's our 6th highest week. The positivity rate is still through the roof, even though it's coming down. So number one thing parents can do is be patient, right? This is lessening. Be patient. Give it a couple weeks. We'll be in a much better place. Dr. Stack, you want to talk about the Pfizer vaccine for kids under 5?
Thanks, Governor, and thanks, Karen. So I take it as a good sign that they're using a rigorous scientific process to review data to make sure that what we recommend for the kids is safe. And so remember, the youngest children are probably at the least risk of major harm because COVID is an age-related disease as far as its mortality. But everyone faces risk, and all of us can transmit the disease. So the final exit strategy for the pandemic is for everyone to have the chance to be vaccinated. But at that young age, they're not just little adults. I mean, they're uniquely physiologic beings. And so they need to be very careful about what they recommend. So I think this is just the normal science working out, and they're looking at whether or not 3 doses is necessary at that age in order to get to a reasonable initial series. And so when they get that data analyzed, they'll come back and tell us. But I read it as just them being responsible and following the normal process.
All right, now remotely, Tom Latek.
Thank you, Governor. Good afternoon. Hope you and the First Lady have something special planned for Valentine's Day tonight. My question is probably more oriented towards Dr. Stack, but if you know the answer, that's fine. Are we seeing any cases of the new Omicron subvariant, I guess they're calling it, in Kentucky, the B2? And is it a mild form like Omicron, or is it a more virulent form like Delta was?
We'll turn that over to Dr. Stack.
Great. So Tom, BA2 is the variant I think you're talking about. As far as the disease itself, what we understand at the moment, it may be spreads even more effectively than the initial Omicron, which is staggering to conceive because the current one spreads alarmingly fast. But so far, there's no suggestion it's more dangerous or causes more harm. As far as the proportion, nationwide in the United States, the current modeling shows around 3.5% or so of all the samples through last week could potentially be BA2. Again, we'll have to see if it takes off and increases or if it doesn't. The predictive models get better as there's more data. We haven't found any that we're aware of in Kentucky yet, but I love these nicknames people come up, is that it could be, quote, the stealth variant, which is a silly misnomer, but it's because it doesn't show a pattern on a couple of the commonly used polymerase chain reaction assays. And so we don't really have an indirect way to find it. We're going to have to find it when we've actually sequenced specimens, and those are usually multi-day processes. So we are not aware of any of it in Kentucky yet, though that doesn't mean it's not here. And we'll get more data in the weeks ahead as we see what unfolds.
Debbie Yetter, Courier Journal.
Thanks, Governor. how did you all arrive at March 14th with your projections as a point where things might ease enough to change some restrictions or guidance? And what kinds of things do you foresee changing, if you can say?
So Dr. Stack has, charted out the rise and the fall at different surges. That is his best advice on when he believes that at the current rate, which is falling, the speed of it won't be as dramatic week over week. But based on what we have seen in the past, with some correlation between speed of rise and speed of fall, that's when he is comfortable that we are likely to be in the orange or even the yellow. As we were talking, we're going to move through the orange really fast with this one, that we might be there a week, less than a week, and hopefully to the yellow. So that comes from his analysis of the data. I think certainly we'll look at a couple things. One that we're definitely looking at is taking our 4 color-coded system and moving it into 3. Given that with Omicron and really even Delta, you go through orange so fast on the way up and on the way down, it probably makes more sense and will be easier for people just to have the stoplight, the red, the yellow, and the green. And certainly thinking about masking on the whole and what the recommendations are, size of gatherings, masking indoors at different gatherings. I think all of that will be included in the guidance. And that'll be guidance for families to make their decisions and also for businesses to make workplace decisions based on how fast the virus is or is not spreading. But I also think, looking at case numbers, at positivity rate, but also looking at hospitalizations, looking at a number of different factors that I know Dr. Stack is planning on putting all into one overall metric to again, give the very best guidance that we can. April Rickard, WFPL.
Hi, thank you very much. I'm not sure if you mentioned this at the start, but what's your response to the shooting of the mayoral candidate in Louisville, Craig Greenberg, this morning, and what that could mean for the mayoral race? And with COVID, should residents change any behavior right now with the numbers dropping? Can they feel safer going in public, or should they still hold up? Thank you.
Well, first on COVID, I don't want people to feel unsafe going into public. I want them to do the things that make them safer. And that is getting vaccinated, getting boosted. And if you're in a large indoor area, wearing a mask. Other than that, have at it, right? I mean, we've got the tools to protect ourselves and each other. And if you just think through those things, and let's remember, nothing's closed. Nothing's been closed for months upon months upon months, if not almost a year in most instances. So we have been open for business, having the best economic development year last year, but at the same time, just providing guidance on the layered mitigation strategies that any family can do. What are the 3 things we can do to protect ourselves and what we're willing to do? But I will say for larger home gatherings and the rest, certainly we're moving in a better direction to where people can, as we move out of the red, and should feel more comfortable with activities that they may put off when we are in the red. But even there, we've recommended that people, whether it's the Super Bowl, have everybody vaccinated. Try to get everybody tested before. Switching over to Craig Greenberg, I've known Craig for 15 years, and the news is scary and horrible. I talked to him as soon as I got the news. He is at least physically okay, but we're praying for him and his family and their safety. I know what it's like to have the threats, but this is a step above and beyond that. And in the end, people will say, "What does it do to the mayor's race?" Who cares? I mean, this is a person that almost lost their life, who's going to be hugging their family tonight, and that's the most important thing. The person who's done it needs to be prosecuted to the fullest extent of the law. And if this has anything to do with a political race, by God, if you disagree with someone, you vote against them. This I mean, any level of violence for that reason, or for that matter, any other, is absolutely wrong. And this is way, way, way over the line. And we really ought to think about the way we talk to each other, especially on the political side, and know that some of that speech can have consequences. Melissa Patrick, Kentucky Health News. And to Craig and
Hi,
Rachel and your whole family, we're glad you're okay.
Hi, Governor. So do you support Senator Alvarado's resolution to require Kentucky to recognize individuals with antibodies, neutralizing antibodies to COVID-19 as being equal to a fully vaccinated person?
No, I don't. It's politics and not science. And the Kentucky Department for Public Health should be able to give the best scientific advice without their advice being legislated. You know, they could legislate a different formula for gravity, but that doesn't make it right. And it certainly makes it anti-science. Corinne Boyer.
Hi, Governor. Madison County announced that it will no longer contact people who test positive for COVID. Instead, they just ask that people, if they test positive, to follow CDC guidance. Given where we are in the pandemic, will other counties soon stop contacting people who test positive?
Many counties have already had to. And part of that, Corinne, is when you look at how many cases we had, it just became impossible. But the other piece is we've been in this for 2 years, and everybody's heard now what you need to do when you have it. And we're seeing really good compliance by people who test positive for isolation. Quarantine, you know, a little more challenging out there right now, but this is starting to become the norm on the personal responsibility when you test positive. So yes, I think you will see that counties will spend less time contacting people directly who test positive. But let me say, if you've tested positive, call your doctor, right? Call a medical professional so that they know that you have it. If you need to call your public health department, we do suggest that, as we're still trying to track this. But you know, sometimes people take a turn for the worse and can do it quickly in COVID. Make sure that somebody that knows what they're doing is checking in on you. You know, we care about you, whether you're vaccinated or not vaccinated. If you get COVID, we want you to be okay. So at least let a medical professional know. Chandler Wilcox, UK Student News.
Yeah, Governor, thank you. I have a few questions. My first one being, you recently awarded Hardin County a grant through the Clean Water Program. And I was wondering, how do you see that impacting not only Hardin County, but maybe communities in Kentucky as a whole?
Oh, our Cleaner Water Program impacts each and every one of the communities. First, it's a grant, which means we can do important work and not raise water bills on the people in the county and around it. Second piece is clean drinking water is a basic human right. And there are still a lot of families out there on well water. In fact, there was a school in Boone County that didn't have access to reliable water, that was having to cancel some days because of it. It's also critical for economic development as well as fire protection. If you don't have the right amount of pressure, you can't fight fires in neighborhoods as effectively as you could otherwise. Chandler said he had a couple, so we'll take one more from you.
Oh, yeah, thank you. House Bill 48 is the anti-swatting bill that would make swatting a felony rather than a misdemeanor. It passed the House on Wednesday and is now moving to the Senate. How do you see that impacting Kentucky if it's passed? How do you have an opinion on that bill? Yes.
This is the one on open records.
The swatting bill that if you call and have someone go into your house.
Oh, right. We're still reviewing that bill. Some of the numbers, House and Senate. We're still reviewing. We'll get you a response, but haven't had an opportunity to fully read through it, which is what we aim to do before giving our opinion or ultimately given comments on it. Thank you all very much. Happy Valentine's Day, and one day early, happy birthday to Dr.